everyone, and welcome back to the Untold Story podcast. I'm Martha McCallum. After President-elect Trump nominated Robert F. Kennedy Jr. to lead the U.S. Department of Health and Human Services, many Americans are looking into how he plans to make America healthy again. And boy, is America unhealthy when you look at the statistics across the board. I had an opportunity to speak with Dr. Bhattacharya, a professor of health policy at Stanford University, who may join President-elect Trump's cabinet. And I discussed with him the status of health in America, how new leadership could impact the food we eat, medical care, whether or not we do what he recommends, which is to move into preventative health rather than trying to fix problems that exist, and chronic issues, chronic health issues, what our kids are eating, cancer threats in our food and our environment. So stay tuned to listen to my conversation with Dr. J. Dr. J, thank you very much. It's great to have you with us. You wrote so many powerful editorials during COVID and gave hope, I think, to a lot of people who felt like the guidance was misguided. You know, my first question for you is, I watched this current NIH director, and honestly, I couldn't understand like what she was talking about in terms of what their role is and what they're supposed to be doing. Did you understand what she was trying to convey there?
I think what she's trying to say is that the NIH has a lot of expertise, and that if we get rid of, a lot of that expertise, that somehow the health of the American public will be harmed. I mean, I'm not saying that that's wrong necessarily, but I think that the question is, like, what has that expertise produced? Has it really benefited the American people? Like, I think, for instance, the NIH invested in very dangerous gain-of-function research that might have caused the pandemic, Martha, and they have not come clean. If reporters that have tried to look into it have been blackballed from seeing documents that are even unclassified. That kind of transparency leads to distrust, and it's partly, I think, why President Trump was elected. The next NIH director, whoever it is going to need to make the agency into a transparent agency that works for the American people rather than for the people with domain expertise or whatever she was talking about. That's not the purpose of the NIH. The purpose of the NIH is to help make help create the science that makes America healthy.
The Untold Story continues right after this.
Yeah, she talked about sitting with people and earning their trust and understanding the community that cares about particular diseases. And all I could think that was going through my head is that we have an increase in disease in this country. For all of this money that is spent, we have 40% of people across the board who are obese, 70% of men in this country obese. This leads to rising cancer, inflammation in the body, all of these things that we have been educated about thanks to you and others. So if you were to be the NIH leader, what is the very first thing that you would do to try to get the country healthier as a result of the tax dollars spent at NIH?
I mean, I think that the key to that's a long-term project, but it's a project that where the science really fundamentally matters. And the NIH has been an agency focused on, infectious disease and things like that. It's not that you shouldn't focus on that, but it's really neglected a lot of the basic chronic conditions that plague Americans: diabetes, heart disease, you name it. For almost a decade, even before the pandemic, the United States had stalled in life expectancy gains. We've lagged behind Europe in life expectancy in years. What exactly are we gaining for the investments we make? I do believe that science is very, very important for making Americans healthy. I fundamentally believe that, or else I wouldn't have chosen the job that I'm in. But I think that what that means, though, is we have to understand what the health needs of the population actually are and work to develop good science so that we can give Americans a good scientifically based, evidence-based advice rather than what we do now, which is, I think, quite shoddy, at least in terms of the results. Stalled life expectancy, chronic disease crisis at scale, that's not acceptable.
And the terrible thing is that we spend twice as much on healthcare in the United States as these other countries who have far better outcomes and longer lifespan and healthier people. So that's not a good return on investment, is it, Doctor?
No, it really isn't. And, like healthcare, really most of that is sick care, right? It's care that happens because we failed as a country to provide the kinds of environments and advice to help people avoid getting sick,
right,
avoid being chronically ill. We have to change that. We essentially invest a tremendous amount of money to cover up the problems that are caused by the failures to protect Americans from the kind of chronic health problems that you outlined very well, Martha, at the beginning. And I think that transformation, it's going to take. I mean, I don't want to like promise something that's going to take 2 days. It won't take 2 days. It's a big problem that's gone on for too long, for decades. It's going to take a little while to change the direction. But the NIH is the most important, I believe, institution to help do that, because it's the scientists that determine the sort of public health agenda. It's the scientists that determine what doctors do, and it's the scientists that do a good job or a bad job in identifying the things that can that help regular people understand how they can become healthier. And I think I do think that's why the NIH, I think, is such an important agency for that.
Well, I encourage people to listen to your studies and to dig into some of the editorials that you wrote. And we look forward to hearing what happens with you and this new program. Hope you'll come back soon and talk more about it. Dr. Jay Bhattacharya, thank you very much.
Thank you.
That is the Untold Story for today. I'm Martha McCallum. I'll see you next time. You've been listening to The Untold Story with Martha McCallum. Don't forget to subscribe on Apple Podcasts or wherever you listen. Make sure to rate and review. For more podcasts, go to foxnewspodcast.com. Listen ad-free with the Fox News Podcast Plus subscription on Apple Podcasts, and Amazon Prime members can listen to this show ad-free on the Amazon Music app.